Good morning, ladies. It's Kim again. I had posted last night about maybe doing a video called My Endometriosis Pain, a letter to emergency room doctors. I'm tired of being treated the way I've been treated, seeing my sisters treated the way they have been treated. So I'm going to be reading from notebook paper because I wrote everything down that I kind of wanted to say in this video. So here it goes. Dear ER doctors, this letter is coming from a very frustrated patient who lives with a disease called endometriosis. I am not alone in my fight. There are at least 5 million plus women who have this disease. Just so you know, endometriosis is an uncurable autoimmune disease. Endometriosis is when the lining of a woman's uterus grows outside the uterus. This wonderful disease causes extreme pain before, during, and after periods. This pain can be located in our lower abdomen, back, vaginal, rectal, and legs, and many other places, just to name a few. As a patient who has suffered from this for more than 15 years and has been to the ER several times, I have a few things I'd like to say. Number one, yes, I know this is a chronic illness, but please do not look at me and say that you cannot help me. I come here most of the times because my doctor has advised me to because of the pain. Remember, I didn't want to come here in the first place. Number two, I'm in horrible pain, but just because I'm not screaming, crying, and such doesn't mean I'm lying. It means I've had to deal with this disease for so long that I can be at a level 8 to 9 and hardly show emotions. I had to learn to keep going and basically fake a smile. I think we can all relate to that one, ladies. Number three, I am not here seeking medication. When I tell you I've already tried Aleve, naproxen, Motrin, Tylenol, and nothing is working, I truly mean it. If anything above had worked, I would not be wasting my time by sitting in the ER while you give me looks like I am a drug addict. Just to let you in on something, I hate having to take anything, and I hate having to come here and getting your stares and wondering eyes. I also hate when I get a doctor who tells me a cyst and endometriosis doesn't hurt. Well, unless you have either one or you live in my body and know how I feel, please do not tell me they hurt. One more thing before I go. Please try to understand that some of the medicine that you try to give me is nothing more than me taking a Motrin, such as Toradol, Tramadol, to name a few. I've tried these medicine a million times, and if I ask for something different, remember, I have dealt with this for going on 15 plus years, so please refer back to when I said I'm not seeking. I just know at this point what will and what will not work for me. It is not right or fair to me as a patient to be flagged in your system because I have a chronic illness or I've been to the ER several times because of this. How would you feel if it was you or your wife, sister, friend, child, or anyone close to you? Wouldn't you want them to be treated properly, with respect, with care? Also remember, sometimes a patient doesn't have a primary care doctor and has to come to the ER. Please treat all patients like you would want to be treated. Stop stereotyping people because of their health problems or their quote-unquote history. Because you never know when it could be you or someone close to you who needs treatment. I understand you are an emergency room doctor, not a primary care doctor or a gynecologist. But we as patients dealing with a, chronic condition still need treatment like the patient in the next room to us. No one likes to go to the ER. Yes, we all know that some people are just there for the medication, but that does not mean everyone is. So please remember, we need understanding from you. If you are not sure what endometriosis is, then maybe you can look it up and get a little bit more educated on it. Because next time a patient comes in and tells you what's wrong with them, then maybe you will understand and have a better education of what they have and maybe have a little bit more compassion. Sincerely, from myself and 5 million plus frustrated women. Now, I know, ladies, that all of us can, relate to this, some more than others, but, I'm just fed up. I'm fed up with our medical system. I'm fed up with doctors. So that's my letter to ER doctors. I'll probably be posting another video later today on how my symptoms are and were with endo. So let me know what y'all think of this video. Talk to y'all later. Love y'all.